Aloha Hawaii. It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Like I said, aloha. Welcome, everybody. Nice to have you with us. This program is due to educate and sort of hopefully entertain you, even about some things that aren't very, very entertaining. But we do entertain the thought of spreading the word about venous disease and a lot of other comorbidities, if you will. And one of the things that we love is when we get to freestyle and get off the chart of speaking about one specific thing, and we actually get to talk with the patient. And you've all heard, I guess, the movie All About Eve. Today, you're going to meet somebody named Eva. So it's going to be all about Eva. And, Doc, this is sort of in many respects, and I know how grateful you are when a patient agrees to come on and talk with us. This is a really neat thing when somebody's actually willing to be willing to share their experience, not only with the doc and your people, but with getting a condition looked at. Let's talk specifically a little bit about how that works. Right. Well, especially with vein disease and some of the abnormal things that can happen that are somewhat unsightly, and people are embarrassed to be out in public. And so consequently, they are a little reluctant to talk to anybody about, this type of problem. So it's always good that people do come in and let us take a look at things. Okay, so when we do this, now the good news is that here we get to talk with somebody that is being treated and is managing a condition that I guess some don't, because we've talked before particularly about venous ulcers, and sometimes people have them and they just keep mistreating them for literally years. Right. Which is the other problem that we run into, because, many of the, repercussions of venous insufficiency of the legs don't necessarily look like a vein problem. When people have varicose veins or spider veins, it's easy. They say, gee, I must have a vein problem. I got veins, right? And other people say, you have a vein problem. But with other types of things that happen, especially like the things that, were progressively getting worse and worse over time with Ava, it's not that easy to connect the two. And not only do lay people not really know it, and unless they've been exposed to it before. They, right? But a lot of physicians aren't necessarily in tune with that whole thing either. And part of that is just because the treatment of venous disease has changed so tremendously over the past 20 years, and we've talked about that in the past. Yeah, we love it, by the way. It's no longer vein stripping. It's dealing with the vein. Well, I think maybe an interesting reflection on that is, and I think you've explained it a little bit before, this was your chosen field of specialty after a number of years of a lot of other doctoring. Yeah. And one thing that I did learn from you is that in medical school in the first place, there's nowhere near the time spent to this condition. Because why? Because it's so slow developing? Well, the part of the problem, I think, with vein disease just in general, and I will tell you, even now, it's tremendously undertreated. Yeah. It's only 5 to 10% of people out there at any one time who have significant venous insufficiency that actually make their way, through the whole system and get to a vein doctor who's going to then do something about it. So, we still have a long way to go, but it has to do with education. I mean, we spend a lot of time educating, our fellow practitioners, folks out there that may or may not have the problem. But, in the past, and you alluded to it before, having vein stripping, surgical vein stripping, was not a palatable thing for most people. We'll get into that in a bit, gang. And also, on the flip side of that is the fact that doctors didn't really have a huge ambition to treat it because it wasn't a very popular kind of procedure to do. The patients didn't really want to go through it. Doctors didn't really want to do it. It was, the recurrence rate, the old way that it was done was quite high. And so, the patient and the physician satisfaction wasn't there.
Oh, yeah, they'll lose faith in treatment. You treat me, and then 2 years later, I got it back again.
Comes back.
But here's the interesting way. We're going to segue into introducing our special guest, Eva, because she's a teacher. And teachers, I guess, would be the most inquisitive. In Hawaiian, the word nieli comes up. Nieli about finding out what the heck is going on. And I'm not sure. We've had some time to spend together off the air just getting to know one another before recording the program, Eva. But I'm not too sure that if you weren't a teacher, that you wouldn't have been as inquisitive or as curious as to yourself with what's going on. So how much of the teacher frame of mind did you have to teach yourself about your condition? And who did you learn from?
I don't know that it was the teacher in me. It was the, oh my gosh, this isn't getting better. So it was really thinking of my mom who probably had vein issues. She got her leg stripped when I was 5 months old.
Oh boy.
And so, some of those kind of things, it did start to affect my teaching though. It had gotten progressively worse.
Doc, we often talk about it's not just a matter of cosmetics or even feeling, but sometimes you're actually prevented from either doing the things you love or from making a living.
Right.
Because you just can't cope with the strain of a job because of a condition.
Yeah, not only daily activities and going to work, but also staying healthy otherwise.
Yeah.
A lot of people say, "Gee, I got to a point where I couldn't walk, couldn't do the normal activities." But Ava brought up two things in just her short comments that are very, very important with respect to venous disease. Number one, genetics.
Thanks, Mom. I often say that. I explain to you, thanks, Mom.
Mother.
Rest your soul, but thanks a lot.
Yeah. And then you can give the bad news to your children, too. So most people with significant venous insufficiency and vein disease, there is somebody in their, prior genetics that had it. A lot of people don't know it, didn't recognize it, weren't aware of it or whatever, but most of the time it's genetics. And then also there are certain professions where people are on their feet more than other professions, and being a teacher is obviously one of those.
Yeah, here's the other list. You're talking about dentists. You're talking about a lot of physicians. You're talking about retail sales clerks. You're talking about coaches. You're talking about tour operators here in Hawaii, and we're outside more often than inside. So you're really kind of talking about us all, Eva. So I'm glad Doc said. And just so that people know, what specific area of teaching, what age group have you mostly worked with?
So I'm an elementary school teacher.
Oh, boy.
And so, you can't
That means they're going in 90 different directions all at once, like trying to bag a bunch of cats, Yeah. But so is Doc right? Is it by just nature that much of what you do is vertical? You're up, standing up a lot.
A lot of times.
Yeah,
right.
yeah.
Right. But as it got worse, I found myself sitting worse because and that didn't work out as well in my classroom either. So there were some real issues.
Okay, now Doc, one of the things I'd really like to get into, and you mentioned this, when somebody has visual veins, whether they be spider veins or big varicose veins, they're more likely to say, "Oops, this is no good," or somebody's likely in their family to say it. But in Eva, I think if I'm not mistaken, when we were talking off the air earlier today, your mom had vein stripped, when you were just a little baby. But was your condition a visible one?
No.
See, that's important. That's important.
There became like a bruise on the bottom near the bottom of my ankle, and it started out that way. I went to a physician. He treated it with antibiotics, but because it wasn't a wound, the antibiotics didn't make any difference.
Right, because it wasn't an infection. Yeah. So give us the timeline. When was the very first time you noticed anything was, abnormally happening with your legs? How long ago do you think that was?
It was more like 5 or 6 years ago.
Yeah.
And I had my legs had become itchy, and I had scratched them, and so I had it. I didn't know. I thought I had an infection and went to the doctor to.
And you had a fair amount of skin changes that were going on and probably getting worse and worse with time.
Discoloration.
Yeah, you said that it all started out sort of like a bruise, and then that probably got a little worse, and then darkened even more, got a little browner.
Right.
Brownish discoloration is something that we see all the time, and then swelling was, I'm sure, when you
always same leg every time I would Thanksgiving Day.
Yeah,
foot swell the whole day.
Yeah.
Once you're on your feet for a couple of hours, getting the turkey and everything ready, my legs were had, and it was more that one leg that had started it all.
Yeah, and then the skin kind of gets worse with time. It got a rashy sort of appearance to it. I would assume, right? And those are all very, very typical things. The discoloration we see all the time. The chronic swelling, and really it's the swelling in the tissues and what's happening as a result of that. That's what's kind of setting up this chain reaction. But there's a term that we use. It's called venous eczema, and that just
like skin, venous skin,
just like eczema otherwise. But it's not on the legs. If you have venous insufficiency, very likely it's not a dermatologic problem. Well, it is sort of a dermatologic problem because it has to do with your skin. But, the etiology is not a dermatologic problem. It's a venous problem.
I think what's interesting, and, you said earlier that it became itchy. And over the programs that we talk about with different patients, we can talk about a whole bunch of different symptoms that are for the same condition. It might itch for you. It might hurt me. It might make somebody tingle. It might make somebody hot. And so, did you have additional feelings other than itching?
Sometimes it would be hot, like it had a fever, and that didn't always exist, but oftentimes it had a fever. It was, there were other issues too.
A couple of the roads that people go down in their treatment as they're trying to sort through it all is it's very, very common. For somebody to say, "Oh, you have an infection, and we need to get you on antibiotics." And as you noted in your case, it doesn't work. The other thing that we hear a lot of is, it's a skin problem, it's a rash, and so we want you to slather all this stuff on it and hope that it goes away. Usually, it does not. It's and again, it's very confusing for the patient. Yeah,
and that's why I'm so glad we could talk. And by the way, there's a host of other stuff you can learn on the website. It's veinclinicsofhawaii.com, veinclinicsofhawaii.com. Lots of things going on. We'll talk about them in other programs. But today, because it's all about Eva, I think that also is, you said something, and I don't want people to miss this. This took a long time to develop. This wasn't something that you had off and on, right? You had it, and then
it was pretty consistent, and it just gradually, very long term, it gradually got worse.
Did it get to your other leg as well?
And the other leg started to get that little sore, and I went to see a dermatologist, right? Because you're saying it looks like a skin problem, and basically he gave me some antibiotics, tried some things, and basically said to me, I don't know what's wrong, and it looks like you're just probably going to have those. But that means that I guess that particular guy, Dr. Juliff, didn't know the options.
Right.
He's up against the wall. Listen, I've done all my bag of tricks, and you still have this. I don't know what to tell you. And
that's the case. But I'm not trying to fault them because again, the modern techniques that we use for vein care these days. It's so much different, than what it was before. Certainly that physician probably didn't have training specifically for venous insufficiency.
And I had been to it for other things, so he's an excellent doctor. He just missed the sign. That's what I feel like. It was like everyone I went to see missed the signs, missed the signals. Could I have had healthier veins sooner? Probably, but they missed the signs.
But what about when you did get, not just to Dr. Juliff, but you did get into finding out what this was most likely to be and what courses of treatments were offered to you and explained to you?
So when I got there, by the time I got there, the ulcer had I had been going in the ocean trying to think,
Yeah,
you
yeah.
know, the salt water
the Hawaiian
out
way
to
will
help.
take care of this.
Right,
Go throw
exactly.
them in the water.
Except for
Yeah,
there was stuff in the bacteria in there.
in
So
the
I
water,
had when I got there, the infection was bad. It had a smell to it. It was really literally
Yeah,
awful.
are you talking about when you came to see us
Yeah.
the first time? I will vouch for that.
Yeah, and you know,
it
here's,
looked
the
terrible.
thing. Here's the thing. When somebody's feeling good, they don't go to the doctor. So the doctor gets people at their best when they've been treated, but certainly at their worst. But I think just in the fact that you specialized in this and you've been, so successful in treatment, that must mean that you looked at each person not as a problem but as a challenge. That, all right, this is what's going on here. And from what Eva explained to me off the air and a little bit on the air, this was pretty out of control. This was pretty big ulcer.
Definitely. Yeah, it was. And the process, if you don't do anything about it, just gets worse and worse with time. And people lose limbs because of it eventually? Yeah, they can. So at some point you need to act on it and, turn the process around. And it makes a huge difference, with respect to, do we, view some patients as a greater challenge than others? Yeah, we do. We absolutely do. And, the rewards are that much greater at the end when we can really have an impact on, not only how people feel, but their well-being and their activity and, being able to do the things that they probably curtailed for a long time.
At what point in time did you feel like you were starting to talk to somebody and some folks that had a pretty good idea what was going on with you?
The first day.
Wow.
Because they looked at it and said, I know what that is.
Oh, boy.
Nobody else had ever told me that before.
I have no clue. I know what that is. Yeah. Good job.
I know what that is.
Yeah.
I know what we need to do. You're going to be back in the office tomorrow and we're going to start doing something. Yeah, it was immediate.
And I guess, Doc, one of the things you mentioned, without wanting to scare anybody or anything, that the reality is that maybe sometimes the clock has ticked for so long. We got people listening right now that are saying, hey, that's me, or that's my mom, or that's my daughter. Is this age, something that you have to be older to get, or do you see this sometime in younger people?
We see it in all ages.
Yeah.
But age is a risk factor for venous disease just in general. But that's just because of the fact that, the older we get, the longer the process has been there. The longer you've been dealing with your own genetics. So, from that standpoint, yeah, it is age-related. But do we see these kind of problems in younger people too? Yeah, all ages.
One thing that, and I'm dying to get into Eva with this one, but I want to ask you first, because you mentioned that sometimes when people come in, the first thing you need to do is get some serious compression on the leg, and when you're looking at a big hole in your leg, I'm not sure that I want to hear that we're going to squeeze it, But that's actually what happens, isn't it?
It is. It definitely is. Like I mentioned before, the basic underlying problem is the swelling. Because the swelling, you can see your legs start to get bigger, and that means that it's swollen. Yeah. But the swelling that we are the most concerned about is the swelling that's actually at the level of the skin. So your skin is suffering because of the swelling and the abnormal things that are going on. But yeah, you're right. Our first step is always to apply some sort of compression, and I think even with you, we started something called Una boots.
Yeah.
And Una boots are kind of an immediate thing that we go to often, along with some local wound care. But again, the goal is to get rid of the swelling, and as you get rid of the swelling, then you start to see the healing process going on.
That is the thing that I most found in mine. And that's why I was so glad when Doc told me that we were going to be talking about this today, because I really relate, because I had a similar situation. But it seems to me that yours was, because it circled your whole leg, something that was like, when they first started to treat it, you must have thought, boy, this is a new day. I mean, something's going on here.
It was a new day, and it was extremely painful because they literally had to scrub that wound and put that uniboot on. This is the same leg that I could barely stand anybody even touching it.
Wow.
And now we're wrapping it.
Yeah.
Yeah.
And I drive an hour home after visiting the office, and every pothole I hit is like, oh.
Yeah. It's not comfortable, especially those first couple of weeks. Because we put the Uniboot, which is a medicated wrap, but it does apply a fair amount of compression to the leg, and that's what gets rid of the swelling. But when you have an ongoing ulcer that hasn't been treated, and it's usually very inflamed and tender. Yeah, tender. So, and we want people to come in, every 3 or 4 days to have their Uniboot.
Okay, here's what I know people out there are listening. If you're listening out there, by the way, and you want to find out more about this, you have to go to veinclinicsofhawaii.com, veinclinicsofhawaii.com. Because, see, if you came back, and you kept coming back time after time to do this, you must have seen something. What was the first sign that something was taking place that you liked?
Okay, so they gave me kick butt antibiotics because I had an infection.
Right.
Next day, scrub it again.
Yeah.
Pain. Yeah. Within a week, the pain had dissipated. I mean, it was still there, but it was like a tenth of the pain that I went in. So just the attention to detail. I was going in every couple of days, and they would wrap. And then as the wound got better and the swelling got better, it became, okay, let's try coming in 3 times this week.
Okay, now wait. At this time, are you keeping this wrap on?
Yeah.
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 I want to make sure that people understand that. This is something you go home, and it does its thing, and then you come back.
Right. And they cut it off, and they wash the wound, and then after they wash the wound and measure it because they're paying attention to those details, and they put another one on.
Mm-hmm. Okay, so now I know that that's not going to be something that Eva has to do forever, No. Now, and I know that I'm probably going to have to wear my compression socks forever, but it certainly is comforting to know that it has that result. So, like me, you're into the compression socks, so you know what those look like too.
Right.
So what determines, Dr. Juleff, how long that sort of treatment is going to be needed, and how does the insurance look at that and look at, how much they're willing to do to reinvest obvious time and money into Eva healing?
That's a good question. There's kind of 2 stages, and the first stage I think probably has to do with the wound, the ulcer.
In other words, kind of emergency treatment.
It's a little more immediate.
Yeah, that's right.
What are we going to do to get this ulcer to the point where it will even start to heal? And with that, compression is so important. Keeping the wound nice and clean and doing what we call a little debridement, periodically. Sometimes we use antibiotics, very, very commonly we might use antibiotics in that situation, but the antibiotics aren't the main thing. Again, it's controlling the swelling. So those initial couple weeks, and if we can get people through the first 1 to 2 weeks,
I was going to say that's a mountain. Once you get over the peak, the rest is you can handle it, right?
Yeah, it was wonderful. I mean, like I said, the gals are marvelous. Yeah, they treated me with respect. They were just amazing.
Well, that's part of it. Dr. Juleff and I have talked about this. I've talked to many other patients. When you go to a professional's office and everybody in there is out competing themselves to be more professional, the results have got to be good. Because somewhere along the line, you must have had, we are an instant gratification society. We want stuff right now. You must have said, I want this fixed right now. And in actual fact, it was pretty quick is what you're saying. It's dealing with turning the corner on this thing.
Yeah, in fact, they thought it would take longer for the wound to heal. But,
you did very well.
They were just amazing.
But that initial relief of pain is something that people really
got to be number one.
Yeah, they're very inspired by it because, and it's amazing sometimes. Like I was saying that if you can get the patient through the first 1 to 2 weeks, it's gold. You're golden by that point because those first few dressing changes with a patient coming in.
Yeah.
You don't have a happy patient.
Yeah.
They're uncomfortable.
I'm sure you explain that this is part of the process, that that there's a mountain of stuff that has to be dealt with before you can get, okay, let's fix this up.
I think the original words were, if this infection isn't cleaned up by Tuesday, we're sending you to emergency.
Yeah.
Those were the exact words.
Excuse me. Now you have my attention.
Thursday, right?
I may just be the patient, but you do have my attention. Yeah,
exactly.
Yeah. Well, I mean, all's well that ends well, and this is not ended, but obviously you're into management, and what we've been talking about from the beginning of the program with Dr. Julev is that venous disease has a propensity to reoccur. That means, and I know you've probably talked about this, and why you and I have talked about my legs, because I am particularly aware whenever there's a ding of any kind, because I know what happened once. So isn't this a bellwether where a patient will realize, hey, wait a minute, I'm going to get on these things day one. I'm not going to wait until it's a ring around my leg.
Yeah. Well, that's true. I mean, venous disease just in general it's an ongoing process. We don't cure people of their underlying propensity to have venous disease because it's a genetic thing. Mm-hmm. At this point, we can't change people's genome yet. Maybe one day.
Working on it, but not yet. Yeah.
So, do you know what I loved though? The one of the things that they said to me was, we're going to take an ultrasound, and we're going to do that regularly because we never want your legs to get that bad ever again. I'm
glad to hear you say that, because that's one of the funnest things for me is to be able to see that probe and watch it on the screen. That's your vein. That's your legs. I think it means that you're more proactive and more able to take charge of doing your part as a patient.
Yeah.
Yeah, ultrasound. We haven't even mentioned ultrasound until right now. It's the miracle.
And that's, we need to touch on the fact that there is a second stage. I mentioned that the first stage is doing something about the ulcer immediately. And then we have to say to ourselves, okay, well, why does this person have this ulcer in this area of the leg? And, there's a variety of different reasons why people have ulcers, diabetic ulcers, a lack of blood flow down, most ulcers in the lower extremity, in the, lower calf, are because of vein issues.
Now, does ultrasound identify that immediately?
Yeah.
That's what I thought.
So, the way that we handle, the type of problem that Eva came in with was, again, we address the swelling, we address the ulcer immediately. We try to get that on the road to recovery. And then once some of that swelling goes away, because often when people come in with a lot of swelling, it's hard to get an accurate ultrasound. So we usually, give them 2 or 3 weeks for the swelling to resolve, at least to some extent. Then we do an ultrasound. And with that ultrasound, then we can find out, or we can find the answer to why does this patient have an ulcer, at this point.
I actually forgot to mention this earlier when I was talking with Eva off the air. I forgot to ask you, and I was keeping this in the back of my mind for the program, and that is, some things we humans do, I think, out of just knowing what to do. In other words, if you're hot, you know to get cool. If you're cool, you know how to get hot. And if your legs hurt, some of us know to elevate the leg. Mm-hmm. Had you gone through periods of just not knowing what you had, but finding out that elevation did help, or did it?
I don't know that I made that connection, but I will say this though. I remember several times sitting in the office, and they have some posters in their office that explain to you the symptoms, pillow, right? And I'm thinking to myself, I have that. Mm-hmm. I have that. Mm-hmm. I have that. My legs were tired every single day when I came home. Mm-hmm. I'd been on them all day. They were just exhausted. So they throbbed at night. Sometimes at night they were restless. And those were some of the things that I saw in the symptoms. So it was like, that to me was like, these guys aren't pulling any punches, because all of those symptoms are happening to me. And
that's why I love, sometimes it's a pain in the butt to fill out all the forms they give you on a scale, number 1 to 10, give me this and that. But it really does. I mean, when you walk into the patient's office, into their little treatment room, and you say, oh, this is a 6 today. We need to take a look at this. And isn't it sort of important for you to be true to your answer on those things? Don't just put no fishing, no fishing, no fishing. Tell them what you caught. You know?
Yeah. Well, and we really do pay attention to that. I mean, there are a number of grading systems of different levels of venous insufficiency, and that not only directs therapy a little bit, but directs the urgency that we feel about any one patient. But then so Eva had the ultrasound, and she had a significant amount of what we call venous insufficiency. Again, veins are the blood vessels that carry blood back to the heart, so it should be consistently bringing blood upward. When veins start to fail, the blood starts to settle down into the leg, and we get pooling of blood,
which also adds to the inflammation and discomfort.
Exactly.
And the discoloration.
Yeah.
Well,
all of the above.
Yeah, that is the reason. Yeah, not only does it lead to, but that is the reason. So we corrected that for Eva, and that was that's the second stage. The first stage is getting that ulcer better immediately, trying to get the swelling done, and then number two, diagnosing the underlying problem, and then doing something about that. And we did some of the standard procedures that we do that we've talked about before to reverse that process in Eva, and her leg turned around tremendously.
Yeah, and that being said, Eva, I mean, did you? And I'm sure it was explained, but the audience needs to know that you could take a very aggressive approach, which obviously the doctor did, getting you into that compression and into that legs jail, I call it, that thing that they put on you. But seeing that it's measurable. So, Doc, I guess the next question is that, or for you too, Eva, that were you unaware that you had venous conditions inside because you didn't see them from the outside?
Correct. I mean, all I saw was the discoloration, and it looked a lot like a wound, an infection. So I had no clue.
Sneaky little things, Doc? Yeah.
Oh, yeah. And again, we fight that all the time because people just don't know, and we try to get the word out with it. Well, that's why we're here today, to get people to recognize it. But yeah, you're right. There's probably 1,000 people out there right now.
Oh, absolutely.
Hopefully, they're listening to the radio, and they may have an ulcer or skin problems of the lower leg. They may be doing something about it. Maybe their physician is doing something about it, which is all good. You have to treat the ulcer, you have to treat the wound, and if there's infection, you have to treat all of that. But there's always an additional cause, and most often it's venous insufficiency. So, you owe it. Those people who have ulcers out there and problems with skin of the lower legs, they owe it to themselves to get to somebody who's going to be able to diagnose the reason and do something about it.
Yeah, that's the key. Now, here's the question that I'm sure a lot of people listening want to know. By the way, if you are listening and want to know more about the Vein Clinics of Hawaii, don't forget, it's a company that started on the Big Island, but they're on 4 islands now. We've got Maui, Kauai, the Big Island, of course, and here in Honolulu. And Dr. Julep and his staff are dealing with this on a regular basis. One of the things that we didn't cover, Eva, is that how long you have been a patient. When did you first, say, from the first time you walked in there and felt as good as you felt once you started talking, how long was that?
So I went in October of 2017.
Okay, so compared to this program, we're looking at a year and a quarter old almost. Yeah. Doc, I do know that may sound like a long time for people that are out there, but in actual fact, it probably took 30 or 40 years to build that problem up.
Right. And which is not an exaggeration.
Yeah, I know.
Yeah, the problem definitely has been going on for 30 years. Well, basically all your life, because you have that genetic predisposition. But, a lot of people we see with ulcers, they've had ulcers they have literally had ulcers for years. And, either have not been able to get them fully healed or, which is very typical, they get healed, doing some of those maneuvers, but then it breaks down again. But again, you always have to get to the underlying cause, the root cause for that stuff.
Okay, one of the things, Eva, that Doc talked about a while ago, and this is why I sort of teased this last week, how's your pain on a scale of 1 to 10, because I hate doing that thing. But on a scale of 1 to 10, the amount of I'm curious, and I know the audience is have you had an uptick in your ability to, number one, work longer, walk more, be on your feet more? What are the benefits? You keep going for treatment. What are you taking home? What are the lovely parting gifts that you get every time with regards to your health?
I remember probably a month before I went in to see the vein clinic. We have a courtyard. Our school is a really small school out at Cobb Elementary School, and it would take me a long time just to walk from the office to my classroom. And I remember,
did you know that it was taking a long time, or you just
I knew it was taking a long time. My legs hurt. I just didn't know. And one of the kind of the immediate things that even after that first time that they went in and treated them, I was able to walk faster, walk quicker. It felt like I had my life and my health back again.
Yeah, and I think, Doc, that's in the bottom line is you can, put your face to the grindstone all day long, but when you hear that from a patient or when you've experienced that as a patient, that's got to be saying, boy, this was a home run. And now here's the next step. If you think you feel good now, wait till we do some more of this stuff.
Yeah. Well, that's right. I mean, the problems that Ava was going through, I mean, those are the patients that we really want to, sink our teeth into, excuse the expression. But, we get the most satisfaction. And, it's tremendously rewarding for me to hear that about a patient that, they feel like it's changed their life. And it can. I mean, that's not uncommon. The bad effects that venous insufficiency and venous disease can afflict people with. It's amazing, the relief that they get after we treat them.
Okay, here's the bottom line, and I think that this comes in ever since, Eva, since we started doing this program, Dr. Julep, I've always been impressed that it's okay. What about your lifestyle is getting better? What about your feeling is getting better? And can you be, doing some of the things that you should be doing to help along? I mentioned the compression stockings because I happen to be wearing mine today, but I got to tell every now and again, I have to tell the doc, I haven't been wearing these as often as I should, but yet I'm like you. When I wear them, the minute I put them on, I feel good. It's just getting them on there. So that means that they're a part of your day. But more importantly, what notice a difference, not just in the walking across the courtyard at school, but what about some of the other things that you are more comfortable or doing or that you couldn't even do a while ago?
Well, I have a teenage daughter, and I felt like she was leaving me behind because there were so many things that she was doing that I would have to sit on the side because my legs just didn't feel healthy enough. But I laugh about the compression socks. So now in the morning, it's like it feels so good to get them on because they're there and they're supporting. Yeah. And then when I come home at night or before I go to bed and I take them off, it feels so good to get them off. Yeah. So
I don't know, Doc, if you understand how much of a relief that is. Of course, you do know because you practice what you preach. But it is one of the best feelings is when you first put them on. And certainly, the next best feeling is when you take them off. Right, but exactly. Maybe you can explain. We've talked about elevation a lot before. Elevation, the moment you change your position and get back on your feet, all the good that you did, it comes right back down again. Yeah. What about these socks? Is it the same way? I mean, I take them off at night. It means that for certain, if I stay on my feet, they're going to swell up. Yeah,
it sort of is. Yeah, definitely. And that's why we encourage people to, either while they're still in bed or immediately thereafter, get those stockings on and wear them as much throughout the day as you can. Which really, brings to another point, often and unfortunately, we would like to be able to, kind of turn things around to the point where you don't need compression stockings anymore. But unfortunately, most people, when they have advanced, the advanced level of venous disease, usually you're going to need some, ongoing compression stockings over a long period of time. But the good part about that is that there's a lot of different options out there these days where you can get, nice looking compression stockings that are a little more comfortable.
Oh, they got neon colors, they got sports colors. Yeah, but there's cool. Another thing. There's another thing, and that is maybe getting to the point where, you really, really need a large degree of compression in the beginning, like I did, sounded like Eva did. And maybe later on, a couple of years into treatment, you don't necessarily mean the Binford 500 binder. You can maybe get along with something that's a little less.
Well,
but consistency being the key.
Yeah, right, right. That is the key. But it doesn't take a couple years after we get through that initial stage where we've turned around the swelling and healed the ulcer and treated the venous, the underlying venous insufficiency. Pretty shortly thereafter, we can get into a lower grade stocking.
Yeah.
When we have people going through the procedures, they're wearing a thigh high stocking, a full leg. But shortly thereafter, we get them into a knee high stocking, and it's a little less compression, and it's really very tolerable. I wear knee high compression stockings every day myself when I'm working.
Yeah, and by the way, that's do as I do, not just do as I say, which is kind of relieving. But then there's the other thing, and we talked about that very early in the program, and that was sometimes people's ability to travel would even get changed because of it's not good to travel when you have venous insufficiency or big problems with that. And you see a lot on TV now. I'm sure you've seen it lately, both of you, a lot of this DVT. Everybody's talking about DVT or now PAD. There's all these new commercials. And they're trying to tell you that this pill or that pill is what you want. And you've told me before, and we ought to get this right out here, they may be working on a bunch of stuff that can help a little bit, but there's no cure in a pill yet.
No.
Yeah.
There is not. No. Especially, for both venous disease and arterial disease. There are more things that we can do to alter the course of PAD, that's peripheral arterial disease. That has to do with the amount of blood, getting down. We can do things like stop smoking, control your diabetes, try to eat low cholesterol, exercise, et cetera, et cetera. We can make a little impact there, but for venous disease, there really are not those things. There's not a pill, there's not an exercise, there's not a diet that's really going to alter it significantly.
And I'm actually very glad to hear that. And I don't know even if you felt, I don't want to say a sigh of relief, but knowing that, okay, I'm not specifically doing anything that is contributing to this getting worse. Some things you can do to make things get better, but it doesn't look like this venous condition is being terribly affected by how much you exercise or don't, or how much you eat or don't.
Yeah, and we hear that all the time. We get that question all the time.
Yeah, I bet.
Patients will say, "Gee, what did I do wrong?" They come in and they say, "Well, I have always tried to be active. I try to eat right, and et cetera, but I still have vein problems."
Yeah. Well, you say, "Thanks, Mom."
Yeah, exactly. Exactly.
But there's the other thing, and I'm sure maybe Eva, you can corroborate this because of you teach. There are an awful lot of people now that want to teach longer than they used to. I mean, not everybody retires after 20 years, just the cost of doing living and wanting to keep doing stuff. But where the curves intersect is when you no longer can physically do the job. And this, but this had to have something to do with your inquisitiveness or your quest, if you will, to find out what's going on, so you can keep working. And I don't mean just working; I mean just doing things.
Well, enjoying working, because
yeah, that's the word I was looking for.
It had gotten difficult just because the legs were so sore all the time. Yeah,
and we've talked about before. As time goes on, unfortunately. People are being required to have to work longer.
Yeah.
Years ago, everybody retired when they're 65. Well, not so much anymore, because of economic requirements that they still have.
I think mine's going to be at 93. That's
I'll be right there with you.
That's just the way it is. But I think more important than that, and I know the same thing because my granddaughter used to come in, Papa, what's that on your leg? And I, it's like the guy that has the COPD that he's explaining in a TV commercial. Well, when you have COPD, but I've noticed that I am more likely to go out and do things and mingle than I used to, because I can't tell. Well, certainly my ulcer is healed, and I'm wondering, was it ever an appearance issue with you where you would make sure that nobody could ever see that?
Yeah. It was at its very worst. It was, I didn't want anybody to see it.
Yeah.
And everybody who did see it would be like, it was embarrassing.
Yeah. And Doc, I get it, and I think that we've all experienced a little bit of that. But in some respects, out of sight, out of mind, right? And it shouldn't be.
Right.
You should look at it. I'm not going to, what's that guy Horowitz? He says, I'm mad as hell and I'm not going to take this anymore.
Yeah.
Well, that's kind of, it seems to me that we just got to know each other a little bit, but that's kind of the attitude that you developed. Okay, now that I know what this is, let's get rid of it. Let's get moving on this.
Well, and like you said, I don't think I'll ever be completely free because the genetics are there. But I'm like, it's just been wonderful that they've taken regular ultrasounds. We've done from that initial treatment. We've done other treatments because my veins want to do their own thing, so they're making their own little rivers somewhere, and they're not supposed to be there. So and they've.
That's actually a good analogy. You know, I call it wandering veins, right? When they just pop out wherever. Yeah. But it seems like, Doc, maybe you can explain to the audience that while Eva originally was not there for appearance at all, she was there for a wound. She was there because she had a venous ulcer.
Sure.
But did not have the immediate signs that, this person's veins are in bad shape. But when you got in there, you certainly must have found some things that you had to advise as the doctor, hey, you may not be able to see these things, but here they are on the chart, and this is what's going to happen if you don't treat them.
Right. Yeah, and that's really what we're treating. We're treating, the root problem, the root cause of venous insufficiency takes place in veins that we don't see. I mean, pretty much for everybody. Yeah. That's why we use the ultrasound so much. But it's important to take care of that, definitely.
And I'm guessing, Eva, I'm not sure, but there must be other people that you've been able to share, not necessarily the pictures or the wound, but the fact that there must be some people who say, you got a little more pep in your step than you used to. I mean, did you feel that nobody noticed, or that you know what I'm trying to get at here? I mean, you didn't do things because, like with your daughter, because you were too tired. That must mean that you deprived yourself of going to a lot of things that you could be.
Or I would sit on the sideline and watch it all. Yeah.
But now, what about people that are listening by the thousands out there saying, geez, I'm just like that lady. I don't know her, I can't see her, but I got one of these things. What should I do? What did it take you to reach out and make that appointment?
What really helped me is there were a lot of people in my circle of friends, church, other people at work that were truly concerned. Yeah. And they would express that to me. You've really got it. It's looking bad. But they were also the same ones that were my cheerleaders as it got better.
That's so good. We talk about a support system, Doc, right?
Oh yeah.
As a matter of fact, let's just go back to, if you don't mind, to the initial. The mummy rap that you had to do when you had to go home to do this. You really need to get support.
Yeah.
And now people understand, Mama's, Eva's being a little grumpy, let's leave her alone for a little while because she's going through this thing, right?
Yeah. Yeah, like we were saying before, it's no picnic to go through, especially those initial stages. There's some discomfort and some, difficult times to get through. It's definitely good to have a support structure that's going to help you get through all that.
And you can see by going to veinclinicsofhawaii.com, when it gets into that, you can see these venous ulcers. And I don't want to say they look worse than they are, but they kind of don't look very good. But I guess the light at the end of the tunnel is, okay, when did you first start seeing them responding to the treatment, where the thing's starting to give you back a leg and not have spaces in between the skin and gaps?
It was immediate.
Wow.
Yeah. It was immediate.
Okay, Doc, explain when she says immediate, what does that mean?
Well, it gets back to controlling swelling, because again, I can't stress that enough. The key to that initial, not only healing process, allowing the healing process of that ulcer, but also getting the patient's leg feeling better. It all has to do with getting rid of that swelling. And probably that's what you did see or feel at the same time as the swelling was improving. Your leg was feeling better, and probably seeing it too in that the ulcer was slowly healing. So,
do you get high fives from the people that indicated before that they were concerned? For instance, your daughter. Obviously a daughter feels really badly if mom doesn't feel good or something looks out of line. She participated in the joy of the healing.
Oh, yeah. It was, but again, there was so many people around me.
Yeah.
All of the teachers that worked with me at school that were very concerned, concerned for my health.
Yeah.
Concerned, you've got to figure out what that is because it can't be good.
Yeah.
They
No, it
were,
really
they
can't
were
be
the
good,
very,
you know.
yeah,
Yeah,
they
these
were
are
the
not
very
good
ones.
things. Yeah,
They
yeah.
were the very ones that were excited when I could get back on my
Yeah,
feet
yeah,
and get back in my classroom and do what I do.
Question about stairs and things. Did you have issues with them before? You know, or are they a part of your life anywhere? Lots of stairs. Let me tell you why I'm asking that. Because one of the first things I noticed was getting my lump up and downstairs was a lot easier. You know, I mean, especially a lot of people, and I was one of them, Doc, and I don't know why this is, but it was more difficult sometimes for me to go downstairs than it was to go upstairs. Because sometimes downstairs, when you're going up, you're sort of pulling on a railing
true.
or something. But going down, it's all of this weight going off the thing. And if your legs aren't feeling strong or if they hurt, I'm thinking, I'm not going to that place today because I don't want to go down those stairs.
Yeah, but you had a little more instability when you're going down. Yeah, that makes perfect sense.
Yeah.
Sure.
And I know that when you're able to get some exercising and some core strength going on, that everything improves a lot. So obviously, what do you look for next? I mean, it seems like you've accomplished and you've really been able to be part of a great amount of healing. What's next as you go forward?
I was at the point in my life where I knew I needed exercise but couldn't do it because they were so sore.
Yeah.
So at this point, it's like I've got to get in better shape.
Yeah.
But my legs can handle it now because they're functioning properly. The compression socks help a lot, but I can do the things that I need to increase my health.
And another important thing, with respect to what's next, and Eva alluded to this before, it's a lifetime commitment now. I'm sorry.
It really is. Yeah.
You and I are going to be friends for a long time. Because you really, when you have the extent of venous disease that you have had and had to deal with, it's really an ongoing monitoring process that we do. And like Eva said, we have people come in every 6 to 12 months. For someone like yours, to make sure that everything that we did before is good, make sure there's nothing new coming up, which there can, and to attack problems earlier rather than later, so that the situation doesn't get as severe as it was before.
Well, that's what I said earlier in the discussion, nipping it in the bud. I mean, now, and I'm absolutely sure that you're like this. If something does happen, whether it's getting scratched by something on a plant or a dog nipping at you or some dumb little thing, you think, okay, you little rascal, I'm going to take care of you right now because I'm not going to let a vein on the inside get tangled up with this thing. I'm going to get this thing fixed.
Yeah. And it's amazing how much those, little tweaks, as you mentioned, how much difference they will make. Like in 6-8 months, some people might have a little bit of return of their, discomfort or symptoms. And that's a clue to us that, we've got to make sure that it's not related to some new venous process that's going on and address it.
I'm wondering, before we go, I've seen there's this horrible reality show on television called Intervention. And they gather around as a family and they say to somebody who drinks too much or who gambles too much or who does something really bad. And it seems to me that you didn't have that, but kind of a little dose of it. And I'm wondering if you would feel more comfortable now of letting somebody else know of a condition that you think, hey, you know what, if you went, I don't mean necessarily your affliction, but maybe if somebody was sneezing all the time, that's not weird? Or if somebody was blinking their eyes all the time. Do you know what I mean? Are you more noticeable now of people around you as you are more active?
Yeah, and maybe ironically, Carly talked to me when I was in the office a couple of months ago, and she said, we're trying to find a story. And I said, I don't know. I'm really comfortable with you guys here, but I don't know if I really want to tell my story. Yeah. And I went back.
Now look, here we got her on the radio for an hour.
Yeah, but many of the people that surround me said, you got to tell it.
Yeah.
We saw it happen. You've got to tell your story.
Well, I for one, Doc, am so glad not only that you have the relationship you do with a lot of your patients, but if we get people come forward one by one, and we've had a couple of other really great examples of, and a wide different variety of some of the things that the vein clinics of Hawaii trust on. That's the proof is in the pudding. So we want you to go to veinclinicsofhawaii.com and look at some of these things. And for everybody here at the radio station, Eva, we really appreciate you coming in and sharing your experience with us with Dr. And who knows, maybe swimming in the Olympics is still on your bucket list. You never know. Yeah. And Doc,
going to the Olympics would be.
There you go. Hey, listen. Hey, everybody has a list of some kind. Okay. Well, anyway, that's it. That's our program for today. We'll see you next time. In the meantime, jump over to veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.